Hello, everyone, and welcome to the Dr. R Show. We'll be coming to your living rooms weekly to discuss various health topics with the help of medical experts in their respective fields. Meet my two very special assistants, Megan and Christina.
And I am so excited because today is leg day.
And then inhale as you lower back down.
They will be with me every week to give us tips on healthy eating and proper exercise.
Stretch and keep yourself hydrated.
So welcome to my show as we both learn together. Welcome to Dr. R. On today's show, we're going to be talking about chiropractic. And with us today is Dr. George Bobbitt, a chiropractor from Mansfield Chiropractic. Dr. Bobbitt, what is chiropractic?
Chiropractic is simply a form, a healthcare method that helps people get well, say naturally, without drugs or surgery. Simply, chiropractors focus on problems of the spine, maybe the muscles, the bones, and then conditions that result from that. So we really work with the nervous system, the muscles, and the bones. That's what chiropractors do.
And how long have you been doing it?
I've been doing chiropractic for at least 15 years and hope to do it for a long, long time.
And where did you go to school?
I went to a school called Texas Chiropractic College just in the Houston area.
So to become a chiropractor, is that something you go to after high school, or do you need a bachelor's degree before you enter chiropractic school? How does one become a chiropractor?
Traditionally, most people that become chiropractors, they do a 4-year bachelor degree, and then after that 4 years of college, they do another 4 years of chiropractic school. And then once that's over, then we're able to start practice.
And so chiropractic has been around since roughly the 1900. How has it changed over that period of time? Have there been different treatment methods that have developed over that period?
There sure have. As we started out, there was one official chiropractic school in the early 1900s, and now in the United States there's over 17, but in the other countries there's already 24. And we went from being just an isolated group to now being integrated in our hospitals. We have chiropractors in VA centers and even in cancer centers. So we're being utilized for our skills and knowledge across the country.
And how does chiropractic differ from osteopathic medicine?
One of the most interesting things is in the early days of when chiropractic was being formed, there was another science, there was another medical science called osteopathy. And simply there was two forms of thought. One was that the nervous system was the cause of disease, and the other one was that the blood, problems with the blood was the cause of disease. And so the main difference over the years between chiropractic and osteopathy is simply how we treat. So now chiropractors treat mostly naturally without drugs or surgery and utilize a lot of different methods, whereas osteopathy utilizes medicines and surgeries as well. So they're very much medical doctors and osteopaths are the same, where chiropractors are not utilizing those tools.
So do osteopaths do the same type of spine manipulations that chiropractors do, or is there a difference?
That's a good question. There is a difference, and the difference has to do with, in my opinion, is this is what we do all day long. Our main form of treatment is chiropractic adjustments or spine manipulations. Whereas with the osteopaths, they're not doing it as frequent as they used to. It used to be a common practice, but not now. They're not doing it as much.
And in terms of the treatment protocols, how many different protocols are there? Are there different sub-segments of chiropractic?
There's a lot of different versions. There's a lot of different styles of treatment because you have to be able to adapt for all ages. So whether there be children or elderly, different techniques work for different people. So I would say that there's at least 20 different styles of techniques plus an integration of all the things that we learn over the years. There's instrument techniques, there's manual forms of manipulation, there's even soft tissue work that we do. So we have to find a way to treat every person any way we can to give them help.
And what's the theory behind chiropractic? What's the science? What's it based on?
This is one of my favorite analogies. I like the breaker box analogy, where in our house we have a breaker panel, and every one of those switches controls a certain part of the house. Where our body has the same thing, where every bone in our spine there's a nerve that comes out, and that nerve goes to a different place. Some of the nerves go to your legs, and some go to your arms, and some go to some of your organs. So the theory is that if the spine is out of alignment, it could create pressure on a nerve. And if that pressure on a nerve went to the muscle, it could make the muscle not work. Or if that nerve pressure went to an organ, it could make the organ not work like it should be. So overall, the idea is if we could take the pressure off a nerve and realign the spine, then we could essentially help them with the condition that they have.
How does the spine get out of alignment?
Most of the time, it's due to some form of repetitive stress or trauma, most commonly fender benders or slips or falls, or just everyday repetitive work. Nowadays with the sitting computers and having mobile devices that we're always looking, we're creating this repetition movement patterns. So most of the time it's going to be some form of trauma, whether minor and all the way up to big deals like car accidents.
And how much research is being done in chiropractic right now?
There's a tremendous amount of research, especially on the cutting edge of what's happening to a body before we treat, what's happening after we treat. So now with MRIs have the capability of giving us that. We're really interested in the disc problems. We're really interested in how do we help prevent people from having to go to surgery if we can, or how do we help people after surgery with that. So most of the research right now is just trying to validate that that the science that we do and the work that we do is there to really help people, and it's here to stay.
And so what's typical, what kind of conditions does a chiropractor treat?
The most common, simply back pain, neck pain, and then certain types of headaches. And that's where right now most of the population utilizes us for. But there's so much more to chiropractic, because when we talk about all the conditions of the muscles, the bones, the nervous system, there's a lot. Sciatic conditions people are familiar with, tendinitis, that's another common form. And then you name it, as far as if it involves the body and the components of the muscles and the spine, we can help. There's too many to mention, but that's what we're mostly known for: back, neck, headaches, and then the extremities, knees, hips, elbows, the list goes on.
So you're mentioning mostly musculoskeletal type problems. What about treatment of asthma, ear infections, things like that? I've heard that some chiropractors treat those sorts of things.
If we go back to the thought process, is we're primarily specialists in the musculoskeletal system. And if the spine is out of alignment and it does put pressure on a nerve, and that nerve went to the lungs, then somebody could develop an asthmatic condition. We don't necessarily treat asthma, but if asthma was a result of pressure on a nerve or a spine being out of alignment, then there's a possibility that we're able to help that condition, help the body heal itself.
So the vast majority of things that you deal with more musculoskeletal.
Yes, that's really where we're really talented, and that's our niche.
Anyway, we're going to have to take a quick commercial break. We'll be right back.
Hey guys, welcome back to Inside Fitness. I'm Christina and this is Megan, and today it's all about the biceps and the triceps. The biceps are in the front part of your arm and the triceps are back here in the back.
So we're going to demonstrate my favorite bicep exercise, which is called the bicep 21s. Now this might be a new one for you, so pay attention closely. So Christina's going to take a stance about shoulder width apart. Her arms are down at her sides, palms facing up. Now she's going to do 7 full bicep curls all the way to the top, all the way down to the bottom. 7 of these. So she's exhaling as she lifts the weight, inhaling as she lowers it back down. And once she's done 7, she's going to stop down at the bottom. And now you're going to move on to your second set of 7. So you're going to lift up till about halfway through the curl, and then inhale as you lower back down. So 7 of these. And then once you're done with that set, you're going to actually start at the top of the curl. And now you're going to lower about halfway down through the curl. Exhale on your way up, inhale on your way down. Okay, now this is your last set of 7, and that's why this exercise is called the bicep 21s. You're doing 7 full curls, 7 halfway up curls, and 7 halfway down curls.
And if you can do that in 3 sets, you're going to be getting a really good bicep workout in.
Exactly. So now we're going to move on to the tricep, which is the opposite of the bicep, and we're going to do the tricep skull crusher. And this one might be a new one to you as well, so pay attention closely. So she's going to start with her arms directly above her chest, arms are straight, palms are facing each other. Now she's going to bend her elbows as she brings the weights down towards her temples, and once they get to her temples, that's where she's going to stop, and exhale as she presses the weight back up. Now you want to pay attention and make sure that the action is coming from the elbows and not from the shoulders. So this part of your arm should be staying stationary at all times. So now once you master this exercise, be sure to get 3 sets of 10. Okay, so these were just a few exercises to work your biceps and your triceps.
So make sure to incorporate this into your fitness routine this week. Always remember to stretch, make sure that you're staying hydrated, and we'll see you right back here next week on Inside Fitness. Hi, welcome back. I'm Christina and this is Megan, and today we're going to show you some alternatives to your household favorites. Now, I understand that the most difficult time to maintain a healthy diet is during the holidays, or even when you're just home or you just want that home-cooked meal taste. So mashed potatoes is one of my favorite household favorites, but in replacement of that, we're actually going to be doing mashed cauliflower. Now this is something that you may have never heard of before. However, cauliflower still has that great starchy substance, and it's a really good replacement for potatoes. A boiled potato is 134 calories, whereas a boiled cauliflower is only 28. So especially if you're trying to limit your calories and your carbs, this is an excellent option. For example, 1 cup of boiled potatoes is approximately 30 grams of carbs, whereas 1 cup of boiled cauliflower is only 5.1. So this is a really excellent option. So prior to getting started, we went ahead and boiled our cauliflower. What you want to do is just cut it sort of coarsely, and then you want to throw it in a boiling pot of water, just like you would with potatoes. It takes probably about 7 to 10 minutes to make it nice and soft, but what I like to do is I just sort of stir it around a little bit, add some sea salt to the boiling water, and then I'll just take a fork and sort of test it. If the fork goes through the cauliflower just kind of nice and smoothly, then I know it's ready. The goal is just to make it easy on yourself when you're going to be in the mashing stages. So we've got our cauliflower all done here. You can see in the pot, before we actually get started with our beaters, you can even just take a fork and just kind of squish it down, and then you can just sort of break up some of those larger pieces. You want to be careful because you don't want to scratch your pot, so you can just kind of get it mostly prepared by breaking up some of the larger pieces. So, okay, here is what we're going to do. We have a nice little ceramic bowl here. We're going to go ahead and take our cauliflower out of the pot. Okay, perfect. All right, so there we go. It already looks like mashed potatoes. You just want to use a tablespoon or 2 of butter. We are using the unsalted low-fat butter, so something that you can kind of use as an option. Just put a little bit of that in there. Perfect. All right. And then we're going to add a little bit of salt and a little bit of pepper. Now, if you wanted to add some variety, you could always add some green onions or some garlic. You could get that great, sort of gourmet taste. But today we're just going to kind of keep it a little bit basic. In place of milk with dairy in it, we're actually going to be using rice milk. One of the things you want to make sure is to use the unsweetened rice milk. There's nothing worse than accidentally using vanilla.
And the benefits of rice milk is that it's actually lower in cholesterol, it's a non-dairy option, and it's also lower in fat content.
Perfect. So what we can do is we can just kind of stir it up together, just kind of mix it a little bit. And then to make it nice and mashed, we'll have Megan take our hand mixer and really blend it together. Awesome. So a couple of things to remember. You only want to start small with the amount of milk that you're going to be adding. You don't want too watery mashed cauliflower, just like you wouldn't for mashed potatoes. This is going to be the perfect consistency. So one other tip I would like to say is, let's not forget, it is cauliflower, it's not potatoes. It's not going to be quite as creamy as mashed potato, but you're going to be basically there. So just keep that in mind when you're tasting it, and we're all done.
We're back with Dr. Bobbitt. Dr. Bobbitt, when you see a patient, how do you go about evaluating them?
This is probably my favorite part of any part of the process. One thing is, the first thing we have to do is sit down and figure out what's wrong. They'll tell us what's wrong, but we want a detailed history, because there's a lot of things that happen to our bodies over the years that we forget or we're not aware of. Oftentimes people think that the condition that they had that just happened, they didn't realize that this thing may have been building up over the years. So the first part of it is to check a great history and get a good consultation. The second thing is, now we have to evaluate them and examine the body. So one of the ways that we do that is we take a spine, and as they lay on the table, we check to see if there are any bones that aren't in the right position, so out of alignment. That's one way. But there's another thing that we do is we check all the muscles and we check all the bones, and in checking those, we'll find out if they're working like they're supposed to. Are they as strong as they should be? We check posture, so if we look, one shoulder might be higher or one hip might be higher. And so once we get the data from the consultation, the exam findings, what we find, then oftentimes we'll even take x-rays. X-rays are real important for us to determine what's going on inside. We want to avoid any complications if we could. So we simply take the exam, the consultation, the x-rays, put them all together, and if it looks like something we can help, then that's what we do.
And so part of your evaluation is feeling the bones of the spine, whether it be the neck, the mid-back, or the low back.
That's right.
What do you do in obese people?
It's the same thing. It's amazing.
Can you feel bones?
Oh, yes.
Even
yes.
if they have 3 inches, 4 inches of fat?
It's so interesting, because as they lay on their back, you can see tissue if it's bigger on one side than the other. If the spine is twisted, you can see it. And you can feel it very, very obviously.
So obesity is not a detriment to your evaluation and treatment?
No, not at all.
So once you've evaluated them, what do you do next? How do you come up with what to do?
Now, once we look at the x-ray, it'll even tell us what position the spine is in. And if the spine is shifted to the left, then we'll do procedures that shift it back to the right. We use, on some conditions, on those that we have to be more gentle with, we have an instrument that we use that delivers a very gentle force. So on children and on our elderly, this is a great tool. But sometimes people, they don't like the idea of having their bones moved, so we utilize something that's like this. It doesn't move the bone in a way that creates any discomfort for them.
So what are the different options available to you?
In the chiropractic field, we have a lot of modalities available. One of those, of course, is spinal adjusting, extremity or joint adjusting. We have massage. We have physical therapy type modalities. However, since we're not physical therapists, we call it physical medicine or exercise or rehab. That's what we'll do. We utilize decompression techniques, and we have special instruments and tools that help decrease pain and inflammation. Nutrition is a big factor, exercise, counseling. So a lot of things at our disposal. So just because we don't prescribe medication and do surgery procedures, we have a lot to be able to use.
And how many treatments does one typically require?
We get this question a lot. If someone was super acute and they have a lot of pain, it may take several visits to get them out of pain. And once that happens, and if the condition's corrected, then it may only take a week or two to help them in pain. But there are other conditions that people have that they're losing function. They've lost function in the body. They may take many, many more weeks than just a few.
So in an acute problem, the treatment plan would be 1 week, 2 weeks?
Yeah, most acute care, a couple weeks. A couple weeks, they're better and they're ready.
And how many times a week would that be?
2 to 3 times a week is ideal in my practice.
And when they're back to their baseline, is that it, or do they need maintenance adjustments?
It depends on what they're looking for. If they're looking for just temporary relief, a week or 2. If they're looking to correct a condition that's been there a long time, it could take several weeks. And then if they want to just maintain for good health, generally we recommend once a month, once every 2 months, and that helps them maintain the spine like it should be.
So what are the risks of adjustments, and how often do problems occur?
One of the beautiful things about chiropractic is the risks are so rare. Most of the time it's soreness from a muscle or from the joints being maneuvered. On rare, there are some complications. Some have been regarded as There's some complications as far as stroke has been thrown out there. The idea that with certain type of adjustment that patients are prone to having some type of trouble there. It hasn't quite been positioned in a way that the chiropractor has always caused it, but the person had a condition that the chiropractic didn't help it, an underlying cause that it didn't help. So we see that sometimes. But most of the time, very rare complications, if any.
That wraps up today's episode. Tune in next week for another exciting edition of Dr. R.